Have you ever had the feeling that something is just not quite right, even when you are not unwell and nothing new is occurring in your life? A 72-year-old woman, whom we will call Ella Lanina, once shared with me, "Doctor, I have been conducting my life in the same manner for 50 years. But in recent times, something simply feels off." She was not ill, and she had not altered any of her medications. Yet something was quietly impacting her. And what she failed to comprehend was how certain personal habits were gradually inflicting harm upon her pelvic health, her hormonal equilibrium, and even her capacity to experience pleasure. I am Dr. Lily Stones, and as a physician who specializes in geriatric care, I have devoted my life to assisting women over 60 in preserving their strength, vitality, and confidence without shame, without reliance on pills, and without any guesswork. Today, we are going to engage in an honest dialogue about an intimate subject that is frequently overlooked, particularly as we mature. You may have been informed for years that self-pleasure is a natural and healthy act, and it most certainly can be. However, after the age of 60, some of the very habits that used to be perfectly fine can, in fact, cause harm. This is the first installment in a series where I will guide you through 7 common mistakes that older women make during self-pleasure and most importantly, how to rectify them before they begin to affect your energy, your comfort, or your long-term health. Please be sure to stay with me, because mistake number 6 is one that almost every woman gets wrong. Before we proceed, if you find this information to be valuable, I invite you to subscribe to the channel for more advice specifically tailored to women over 60. And if this particular topic resonates with you, please let me know by typing 1 in the comments section. If it does not, type 0. Your feedback is instrumental in helping me create better content for you. Now, let us take a closer look at the first mistake, one that has become more prevalent over the years and is quietly reshaping how your brain and body respond to pleasure. Mistake 1. Using erotica as the primary stimulus. I cannot express to you how many women I have consulted with, often in their late 60s or early 70s, who present to me with the same concern. "Doctor, I am unable to feel much anymore. It is as if my body is becoming numb, and I do not know why." The origin of this issue is typically linked to a simple question I pose to them. How frequently do you rely on romance novels or explicit videos? Nearly every time, their gaze lowers, not from a sense of shame, but because they never once considered that this might be causing harm as we age. Our brain's dopamine system, the part accountable for pleasure and motivation, is not as sharp or flexible as it was previously. Overstimulating the brain with high-intensity content can overwhelm it, resulting in what we term dopamine fatigue. Over time, your brain becomes desensitized to this artificial stimulation. This means that the genuine pleasure you once experienced in a natural, intimate connection begins to fade. Your partner's touch may not feel the same, and your body may not respond as swiftly. Even if you remain physically healthy, that deep connection and spark of intimacy may quietly slip away. Many women blame themselves for this loss of sensation and pleasure, believing that aging is the problem. But in reality, it is overstimulation, not age, that is the culprit. If you have observed a decline in your sensitivity or connection, do not disregard it. This initial mistake might be the concealed reason behind it all. Mistake 2. Masturbating while sitting on the toilet. This next mistake might sound innocuous, even convenient, but let us take a moment to truly consider it. Over the years, I have spoken with many women, like a patient of mine named Carol, who quietly confessed that the bathroom has evolved into their private sanctuary. It is a space where no one intrudes, where they can lock the door and feel secure. However, many women do not realize that masturbating while seated, especially on the toilet, is causing more harm than they imagine. As we mature, circulation becomes one of the most vital systems to protect. Healthy blood flow is crucial for sexual function, pelvic health, and lubrication. But sitting for prolonged periods in a hunched-over posture, such as on a toilet, restricts blood flow to the pelvic region. It can exert downward pressure on the uterus and bladder and tighten the pelvic floor, leading to nerve and tissue damage. I have observed this pattern in countless women who, years later, develop bladder leakage, pelvic heaviness, or lower abdominal pain. And yet they never connected it to this seemingly harmless habit. The solution is simple awareness. Consider altering your environment. Try lying down or reclining. Grant your pelvic organs the space to be supported and to circulate blood freely. Your pelvic floor will be grateful for it. Mistake 3, rushing the experience. 1 of the most pervasive habits I observe in older women, particularly those who have spent decades juggling responsibilities or have simply learned to keep things quick and quiet, is rushing through the experience of self-pleasure. They often approach it like a task to be completed, a moment to get over with, rather than something to be fully savored. But here is the problem. After 60, your body does not perform well under pressure, both physically and emotionally. I have had patients like Diane who tell me, "Doctor, I just want to get it done. I do not have time to linger." When you rush, you are sending your nervous system into a state of tension. Your heart rate elevates too quickly, blood vessels constrict, and the relaxation and hormonal benefits such as oxytocin, dopamine, and serotonin do not reach their full potential. While you may achieve a climax, your body does not receive the true reward. When you hasten through the experience, you deprive your body of its natural relaxation responses. Instead of feeling satisfied, you might feel empty. Instead of feeling energized, you feel drained. Over time, this hurried habit teaches your body that pleasure is something fast, shallow, and disconnected. It becomes more difficult to build arousal slowly, and you may even struggle to maintain interest in intimacy with a partner. This is not just old age. It is the habit of urgency, a habit that robs you of something far more powerful than just a few minutes of relief. Slow it down. Let each moment be intentional. Your body is still capable of deep sensation. You provide it with a space to feel. Breathe, pause. There is no finish line anymore, only presence. Mistake 4, ignoring the pelvic floor now. Let us discuss one of the most important yet frequently overlooked aspects of your health, the pelvic floor. Most women have heard of Kegel exercises, but very few truly comprehend the significance of the pelvic floor, especially after 60. This group of muscles, situated at the base of your pelvis, is the foundation for everything from orgasms to urinary control. When these muscles become weak or neglected, your entire pelvic health can begin to deteriorate. I remember a woman named Sandra, a former teacher and grandmother who came to me in her late 60s, complaining about a decrease in sexual satisfaction. She said, "Doctor, I stay active, but something just does not feel the same anymore." What she did not realize was that her pelvic floor, once strong and engaged in her youth, had become dormant. Years of sitting, childbirth, and neglecting this vital part of her body had left her disconnected. When you masturbate without engaging your pelvic floor, or worse, when you bear down and push, you are placing unnecessary pressure on your pelvic organs. Over time, this weakens the very muscles that should be supporting them. This can lead to issues like bladder leakage, diminished sensation during climax, and even pelvic organ prolapse. The good news is that you can reactivate these muscles. Gently contracting the area you would use to stop the flow of urine during arousal helps to build awareness and strength. With time, simple habit can restore not only physical function, but also confidence. Mistake 5, a frequency that's too high or too low. This is a subject that many older women hesitate to discuss. How often is too often or not often enough? Some women worry they are doing it too frequently, while others quietly wonder if they have gone too long without. The truth is that both extremes can cause harm. If you masturbate too often out of habit, boredom, or unresolved emotions, your body may start to lose sensitivity. Tissues can become irritated, and over time you may notice a decrease in interest in real intimacy. It becomes less about desire and more about routine, which dulls the nervous system and drains vitality. On the other hand, if you cease the practice altogether, perhaps due to menopause, health concerns, or the belief that you are too old, you may be missing out on the benefits of circulation. Sexual arousal helps to keep blood flowing to the genitals, which nourishes tissues, maintains elasticity, and prevents vaginal atrophy. When you go too long without it, dryness, thinning, and a decrease in desire can set in. There is no perfect frequency, but for most women over 60, 1 to 3 times per week, performed consciously and with care, tends to be the sweet spot. This allows the body to maintain circulation, restore hormonal rhythm, and keep the system alive without causing exhaustion. Remember, this is not about rigid rules. It is about listening to your body. Your body communicates with you, and the key is learning to hear its signals. Mistake 6, using too much. Pressure or force. One of the most overlooked mistakes I see in older women is the use of excessive pressure when they touch themselves. It is a silent habit that can have lasting consequences. I have lost count of how many women sit in my office, frustrated and confused, saying things like, "Doctor, I do not feel as much as I used to," or "It takes a powerful vibrator just to feel anything at all." It's the common thread. Behind these complaints is an over-reliance on intense pressure or high-powered toys. I understand that, as sensitivity naturally changes with age. It might feel as though you need stronger stimulation to experience pleasure. But here is the thing. Applying too much pressure is actually damaging your body. The nerves in your clitoris and vulva are delicate, and aggressive friction can cause real nerve desensitization. Over time, this kind of overstimulation can alter your ability to respond to more subtle touches, whether from yourself or a partner. It is frustrating, yes, but it can also be permanent. When you rely on intensity to feel something, you risk losing the ability to experience pleasure with gentler, more intimate stimulation. So, what is the solution? Adopt a gentler approach. Your body deserves kindness, not force. Use softer, more mindful touch. And give yourself permission to explore different sensations without rushing toward the climax. Your body will thank you for this shift in approach. Mistake 7. Masturbating without emotional connection or intention. The final mistake is deeper than technique or frequency. It is something emotional and spiritual. Over time, many older women begin to view self-pleasure as something mechanical, routine, or even empty. It becomes a way to escape loneliness or simply a dull habit devoid of thought or emotion. I have spoken to many women in their 60s, 70s, and beyond who express the same sentiment. It does not feel like it used to, or I do not even know why I'd bother anymore. And while your body may still function, your heart and mind are not engaged. There is no emotional connection, no presence, no warmth. This emotional disconnect has physical consequences. When you masturbate without emotional intention, you miss out on the full benefits of pleasure. Your brain does not release the same healing hormones like oxytocin or dopamine. Instead of feeling joy and satisfaction, you experience a sense of emptiness. But it does not have to be this way. Self-pleasure can be sacred and meaningful. It can be a moment to reconnect with your aging body, not in shame, but in gratitude. Even solo touch can be fulfilling, provided it is done with intention. It is about slowing down, being present, and appreciating the sensations your body still offers. Conclusion: reclaiming your connection. Now that we have explored these 7 common mistakes, let's take a step back and reflect on the bigger picture. If you have made it this far, I want to speak to you not just as a doctor, but as someone who deeply respects the journey you are on. I have watched many women struggle in silence, blaming age, hormones, or even themselves for the changes in their bodies. But the truth is, no one ever taught us how to care for our bodies as they age, especially when it comes to sexuality, pleasure, and connection. All of these mistakes, whether it is using erotica, poor positions, rushing, ignoring the pelvic floor, frequency issues, excessive pressure, or a lack of emotional connection, have one thing in common: disconnection. And that is the real threat. It is not menopause, not aging, but the slow erosion of your connection to your own body. your own pleasure, and your vitality. But here is the good news. It is never too late to reclaim your body. It is still alive, it still feels, and it still matters. Think of your body as a cherished garden. With age, it requires different care. But that does not make it any less valuable. In fact, it makes it more sacred. So, what can you do now? Start small. Be gentler. Be more mindful. Relearn the landscape of your body. Use intention, not habit. Use curiosity, not shame. Stop chasing performance and start honoring sensation. And most importantly, do not stop believing that connection is still possible, both with yourself and with others. The road to rediscovering your sexual health, pleasure, and vitality as you age does not have to be difficult. It is about starting with the basics: awareness, patience, and intention. The most important step is cultivating mindfulness. Be conscious of how your body feels in any given moment. This awareness can help you identify where you may be holding tension or rushing. If you have been relying on intense stimulation, try slowing down. Focus on your breathing. Feel each moment, each sensation. Let your body lead the way. Lastly, shift your mindset when it comes to pleasure. Move away from the idea of quick relief or performance and instead focus on presence, intention, and connection. It is not just about feeling good. It is about reconnecting with your body and experiencing a sense of peace, joy, and gratitude. Your journey is far from over, and the best is yet to come. Thank you for taking this time to explore these 7 common mistakes and how to fix them. I hope this has helped you understand that you still have the power to live a full, vibrant life. Take care of your body, listen to its needs, and always remember that your pleasure, health, and happiness matter.